Thank you. We're going to begin with Alex Weldon from WPRO. Governor, he asks, what is the constitutional footing for delegating mask fining to the Department of Health?
Yep. So most of the executive orders are done pursuant to Article 9 of the Rhode Island Constitution, which gives the governor broad authority in a state of emergency like we're in now. And it's not that unusual for the Department of Health to issue regulations of this kind as they combat this kind of a serious public health emergency.
Our next question is from Stephen Triedman of Eastside Monthly. We've heard from a number of small fitness, Pilates, spinning, and yoga studios that fall under the large gym umbrella and remain closed. They are desperate to reopen to survive and have asked if there could be a sub-classification in the gym category that would allow them to open sooner.
It's a great question and literally something we've been working on today. The answer is yes. We're trying to figure it out. I don't have something to tell you now. As of phase 1, they're still closed. The official guidance is no change on Saturday. However, I understand what you're saying, and we're working very hard to try to figure out which subset, how to define it, under which safety guidance. And actually, we're in discussion with a number of folks who own those sorts of studios. So as I said 10 minutes ago, we're going to continue to have updated guidance. Maybe I'll have an announcement on that in a week or so, and we're trying to get there.
Bill Bartholomew has the next question. Governor, some restaurants in Providence have announced that they are not going to open during phase 1, citing risks to guests and staff. Are you counting on individual business owners to assess that risk, or would you prefer a more unified approach within industries and sectors that is driven by your decision?
You know, it's an excellent question. Look, at the end of the day, I can't force somebody to open. If they just don't feel safe, then I understand that, and they're gonna do what they think is right for them and their employees and their customers, and I absolutely respect that. Having said that, there's a lot of people out of work right now, and we're doing a huge amount of analysis, taking it slow, making sure it's safe, giving extra guidance. So what I would say to them is, and I'm going to say this to everybody, I know you're afraid. I understand that. But we do have, as long as we go slow, remember, our goal is don't let the virus get ahead of us. But if we go slow and follow the new rules, we got to get back out there. We have to be brave. Smart, follow the rules, but brave. And so that means getting back out there. So in phase 1, restaurants are closed anyway for in-room dining. But and again, I'll never force any in particular business to do what they think is not in their interest. But what I can say is, when the time comes to open for in-room dining, we're going to give you our best advice, and we think it's safe, and so you probably ought to do that.
Michael BiLo of Motif Magazine says small businesses approved for PPP have a June 30th expiration deadline without congressional action, but don't know to what extent they can reopen by then. What is your best estimate of what July might look like for bars and dine-in restaurants? Could they be at full capacity?
It's possible. You know, it's impossible for me to say the first week of May what the last week of July is going to look like. This thing changes daily and weekly. I think it's probably unlikely, but I don't know. Look, listen, our goal, it all depends on our experience. And that's why in the beginning we really want to take it slow. If the experience is such that when we're all going out and restaurants are at 50% capacity and we're not seeing an increase, then it'll give us confidence to relax. But it's just, I can't honestly give you an estimate now because, candidly, it depends what things look like in a month from now.
Continuing the theme, Ted Nesi of WPRI 12 says some business owners say they want to start reopening in phase 1, but claim their employees say they won't come back because they're making more money on unemployment. Is that allowed, and what should employers do in this situation?
It's an issue. I'm going to say that is a real issue. I want to be careful here because I am so deeply grateful to the United States Congress and our congressional delegation for moving quickly to expand unemployment insurance. It was the right thing to do, and it is saving Rhode Island. On the flip side, the additional $600 check, which was well-intended, is, that's a factor. It's relating to what you say. Now, it does expire, so definitely when that goes away, that calculation will change for people. Here's what I would say, and this is what I would say. Do the right thing. Like, it does frustrate me that, this was an initiative intended to help people get back on their feet. It was not an initiative for folks to make more staying home, and then that hurts their business. That was never the intent. In the long run, you're going to want your job to be there. So if your employer is reopening, I'd encourage you to work with your employer and get your job back. And there's only so much that we can do. What we are trying to do is help businesses find employees. So we're using Skills for Rhode Island's Future. We're doing a lot of matching. We're trying to train employees and work with employers. But I can't deny that what you say is a fact, and it's what's happening in the labor market. By the way, not just in Rhode Island, it's happening in America.
Steve Allquest of Uprise RI has a question posed to both the governor and Dr. Alexander Scott. What kind of guidance are you getting from the Commission on Health Advocacy and Equity, established to advise you on racial, ethnic, cultural, and socioeconomic health disparities on your reopening plans?
I very much appreciate that question, Steve. Our leaders in our RIDO Health Equity Institute are working very closely with the leaders of the Commission on health advocacy and equity so that we can assess together ways to place a racial and equity lens onto every element of our reopening. When the governor walked through the triggers, for example, for moving into phase 1, it was that effort that helped lead to why one of them includes making sure we have the capacity needed in our communities disproportionately impacted by COVID-19. We also want to continue to work together on how we can incorporate that lens into our reopening. We've already begun thinking about how to make sure businesses within communities hardest hit are able to participate and engage with us in the reopening process. And we'll want the Commission for Health Advocacy and Equity to continue to hold us accountable, knowing how critical it is to make sure that on the other side of this, we have communities in every zip code in Rhode Island who has bounced forward to be stronger, more economically resilient at the end of this pandemic so that we can all be prepared going forward together.
Christian Winthrop from Newport Buzz asked you, Dr. Alexander Scott, how many travelers entering Rhode Island on the mandatory 14-day quarantine have tested positive for COVID-19?
That's a great question. It's similar to the one that was asked yesterday about how many out-of-state visitors were hospitalized. That's data we are still culling. We haven't forgotten about that question. It requires us to go back through every single hospitalization and now case to help understand that. But my understanding, particularly for those who have traveled and needed to quarantine, that number is relatively low. The quarantining process is a critical one. It allows us to help make sure that someone can monitor at home, not in the public setting, for symptoms to develop, and then we can work towards getting them tested. So the number that we will have, which we'll work towards obtaining, would be among people who were unlikely to transmit the virus to another person because they were following the process appropriately, and that at all times is the key. We want to make sure that someone does not transmit COVID-19 to the next individual by doing the social distancing, wearing the masks, quarantining upon return from travel, and washing your hands regularly.
Governor Doug Lizette has another question about gyms. When will they be able to reopen, and what rules do you expect they'll need to follow?
So gyms, we're targeting for phase 2. It's a little bit more complicated, obviously, with equipment and sanitizing the equipment. As I said, in an ideal world, We think phase 2 will be about 14 days, from phase 1. And what rules will they follow? I don't now know. We're still working on that guidance, but it'll be, much as you would expect. More social distancing, limited capacity, perhaps limits on the number of people who could be in the gym at any one time, extreme cleaning protocols, et cetera.
John DePietro asks, can churches open Sunday for Mass on Mother's Day? Why not let churches conduct Mass outside or by using spacing in the pews? Why don't you consider church an essential business? And lastly, faith is not a social gathering.
Yeah, so it's a good question. Like I said, we've been talking an awful lot to all faith leaders. I've decided to go for now with the five people. So you could have 5 people in a church or synagogue and broadcast that. You can certainly do, lots of folks are doing the drive-through services, and something more will come soon. But everything I know says take it slow. It is so much better to go slow and gear up than to go too fast and pull back. So if that means waiting another couple of weeks, as hard as that is, I have decided, in consultation with many leaders in faith communities, that that's probably the right way to go.
As Dr. Alexander Scott mentioned earlier, and this is Tim White's comment, 2 residents at the Veterans Home who have tested positive for COVID-19 have died. Staff members have told us there is a shortage of workers and PPE there. What is your understanding of resources at the home right now?
Yeah, it's definitely a place where we are focused in terms of making sure that the adequate PPE is there and that we're responding to the staffing needs. Sometimes it can happen quickly and the message can come through that someone isn't available to come in for their shift, but then work is done in collaboration and they're able to address that. So that's something that we're in constant communication with the Vets Home about, as well as the other nursing facilities, to help support them in coming up with the solutions for stable staffing. And I really credit our team that the governor referenced earlier in helping to make sure that we have personal protective equipment as a state. Our priority is the healthcare workers in hospitals as well as in our congregate care setting nursing homes. So they know, and we are very quick to respond whenever additional PPE is needed, that we get it to them. So that's been our focus.
Elizabeth McNamara asks, the 10,530 cases of COVID-19, are they all test-confirmed cases? Is there any use of presumed positive COVID cases on the data dashboard?
So yes, Elizabeth, these are the 10,530 cases that we have tested that we know of. And it's really important to use that message to say if there's anyone out there with symptoms of any kind, knowing that it can be a wide variety of symptoms for COVID-19, please do not hesitate to get tested so that we can support you. That is when the test works the best. That message stays the same. When you have symptoms and you get tested, that gives us the most accurate results for being able to respond and help you get isolated and your contacts get quarantined and stop spread of the virus to other people, knowingly or unknowingly. There's no longer a reference to presumed positives for cases. That was early on. Our state health laboratories have done the validation processes immediately, very early on, and every case that we have is a positive case based on our laboratories' identification of it.
Nancy Thomas of RI News Today has a similar note and also question. We hear every day about specific problems at the Veterans Home. As we see a consistent majority of deaths each day happening in nursing homes and group homes, what whole system change is being looked at to stop this steady tragedy of 10 to 20 deaths a day continuing?
It's an excellent question, Nancy, and something that we are addressing on a daily basis. We had even an extensive discussion with the governor today. There are always components of addressing what's urgent now and helping to make sure system-wide that there is workforce stabilization. I've shared some of the policies and regulations that we removed barriers so that we can get people into the workforce to be able to support. I want to continue to encourage anyone who's taken advantage of those opportunities to show up and help us in shoring up the workforce in our nursing home settings. We also are going in to make sure they have the infection control support, the PPE support, and what's needed to address the immediate. We also want to look forward to seeing how the stabilization can occur at a system-wide level for the long term in Rhode Island. As COVID-19 is here, this is something that's critical because we have a medically and physically fragile community in a congregate setting. So we want to apply all of the elements of what we're doing for the immediate and the long term to help make sure that we have a system-wide response and helps address this ongoing challenge.
Our last question today is from Mary McDonald at the Providence Business News. Several rural communities and zip codes are showing a high rate of infection. Greenville and Burrville, for example. What's the cause of this?
This is a message that we've relayed early on. COVID-19 is not looking to only occur in certain areas. It does not care about borders between cities or towns. It does look towards people who are older or who have underlying illnesses and communities that may be more vulnerable to that because of challenges within their communities that we need to address. But we are seeing COVID-19 impact people of all ages and in every zip code and in all communities. So we want to continue to place a lens on each community, help understand what's needed, make sure that access to testing is there and the services are there for each community, and that's why we are sharing the data as well on zip codes so that we can partner together on being able to address that and help keep our hands wrapped around COVID-19 as a state in Rhode Island.
Thank you, Doctor. Take care, Governor.